Having a spouse diagnosed with Parkinson's disease could be a life-changing experience. I'm Dr. Anna, neurologist from Parkinson's Clinic in Scarborough, Toronto. If your spouse is diagnosed with Parkinson's disease, it has a significant impact on you. However, if you think positively, you can still have a very close to normal life, and you can still have a reasonable quality of life. Patients with Parkinson's, they need your emotional support in the beginning, but as the disease progresses, they might need physical support. Parkinson's disease is a chronic progressive neurological condition. So you need to understand that patients feel very vulnerable with this condition and they want reassurance. So for a spouse to reassure them time to time that you will be there to support them whenever needed is very helpful. It keeps the patient's morale very up. You should also talk to them openly and have a frank discussion. And sometimes have a good quality time and sit with them. Spend some time talking not about Parkinson's or medications or complications or future, but sometimes sit down with them, talk about past memories, your family, friends, in which houses you lived before, neighborhoods, or your children, or if you have grandchildren, because these patients, they are looking for company. They need someone to talk to them. So exercising with these patients also improve their compliance with exercise, because if there are two people exercising together, it's very boosting. And also patients tend to follow exercises regularly if they have someone who is exercising with them. If they have to exercise alone, sometimes they exercise for a few days and then they tend to slack or slow down. As a spouse, you should also watch their behavior. Sometimes they could have feeling of anxiety or depression. They might feel low sometimes. Sometimes they have hallucinations. They see things which are not there. So they might say that, oh, there are people in the house, or there are animals in the house, or they see children outside. You should explain them gently, neither reinforcing their observations or not argumentation. So watching their food is also important, because as the disease progresses, the appetite may become less, patients may not eat very well, and they start losing weight. So you should closely watch what they are eating and also monitor their weight. Supervising their medications. As the disease progresses, patients may have trouble with their memory. Sometimes they may have difficulty keeping track of the medications. So always use a pill box and also monitor what medications they have taken. Try to go to the appointments with your spouse. Make notes. And also in between the appointments, if you have any observations, make notes. And when you go to the doctor, ask questions. Ask about those observations. Ask about those behaviors. Sometimes patients may develop paranoia. As the disease progresses, patients may feel that their family members don't like them anymore. Some patients would say that they're stealing their belongings or they're trying to poison them. We need to understand that these patients are not doing this intentionally. This is a medical condition, so you need to reassure. You need to discuss with the psychiatrist. They might teach you tips how to deal with these issues. Not arguing with patients or getting angry or upset is the key. Just explain them gently and understand that they are not doing this intentionally. Patients sometimes may get confused as the disease progresses, so their memory may not be as good. They might start losing track of time. So a frequent orientation is always helpful. When the disease is advanced, you should tell them every day what day is it, what month is it. You could write on a piece of paper and put in their room, which helps to orient them. Also, when you make any decisions, please involve these patients. Ask them their opinion. They feel to be included. As a spouse, you have a relation with your husband or wife, right? So as the disease progresses, patients may not be able to fulfill the intimate needs of a relationship. So you need to be understanding this, and having a frank discussion is always helpful. Thank you so much.